It's Dr. Fox, licensed psychologist in the state of Texas. And in this video, we're going to talk about what is called a punishment plan. Before we get into it, we see this in individuals with borderline personality disorder, narcissistic personality disorder, and obsessive compulsive personality disorder, and as well, antisocial personality disorder. Now, we can also see it in a lot of varying degrees. Now, we're going to define it, right? We're going to talk about its purpose and all of that. But it's important to realize this isn't something that's just in BPD. It's something that we see in varying degrees, but greatest severity tends to be in those with personality disorders. So what is a punishment plan? This is a conscious or unconscious maladaptive strategy to cause stress and disruption to an identified target. Now, that identified target could be a loved one, could be a boss, could be a therapist, could be anyone in your life. And it follows a feeling of disappointment, rejection, or other adverse trigger or emotional button. And what happens is, in a punishment plan, is that you feel like you've been rejected. You feel like you've been hurt. Maybe the individual incurred a narcissistic wound. Maybe for someone who's along the antisocial spectrum, someone who was trying to manipulate you, but they weren't able to do it, and you foiled that plan, and they put you on this punishment plan. And what happens is it's to cause distress, sometimes to yourself, and that happens a lot with those with BPD, or in narcissistic personality disorder and in antisocial personality disorder, and it's also in those with OCPD, obsessive compulsive personality disorder. They tend to put it on an other, someone external, someone outside. And it can be to cause them distress, irritation, agitation, just frustrate them. And it's not always conscious. It's not like, oh, I know I'm really going to frustrate them. I'm really going to give it to them, and they're going to love it, right? Love it being that sarcastic love it in frustrating them and getting them irritated. Now, why would they do this? And what happens is we see that there are three components to it, which is the first, it's a release of anxiety, frustration, anger, or other adverse psychological emotion that the individual is getting out, okay? That they are going through that process. Now, getting out could also mean that it's internalized as well. They're putting themselves on a punishment plan to feel bad, to make them feel low enough, broken enough. And the second component would be to get an identified other to feel what the patient or individual is feeling. So I want you to feel how hurt I am or how frustrated or angry I am. So I'm going to put you on this punishment plan so that we will suffer together, right? Misery loves company. So it's getting both, and that's not always conscious. Remember, sometimes it's unconscious. And then lastly, the last purpose or component is it's to attempt to get a repair experience to obtain evidence that the relationship is safe and will continue. And this is, right, so I'm going to disrupt the relationship as much as I can. Then we're going to repair it, and that will prove to me that we have a good relationship or a stable relationship. We see that a lot in individuals with BPD who experience abandonment fears, rejection sensitivity, and they pick up on something in the environment that they're going to be discarded, that they're unimportant, or they've some type of detachment or loss or frustration or disappointment from the identified other. Sometimes the identified other doesn't even know it. And the punishment plan comes in. And sometimes, like in a therapeutic environment, you may see where the client is saying, nope, 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 that's not true. That's not true. When you make interpretations, they push back on that, even though you're reframing what that individual is saying. That's the punishment plan. It's to frustrate and anger and irritate the therapist in that case. And it happens a lot. And a lot of times it's unconscious. And what's interesting is in the therapeutic context, if you bring it up and say, okay, I think we're going through a punishment plan, usually because they're agitated and they're not done with their process yet, they end up saying, no, you're wrong. Nope, 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 because they're already on the nope, 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 and you're still on the punishment plan. So you have to, of course, be aware that it's going on, but also recognize that the plan, in many cases, needs to play out. Now, when we talk about if self-harm is an issue or something like that, then intervention needs to be done. You wouldn't say, okay, well, the punishment plan, maybe it's an internalized one where the individual is self-harming, and they may end their life or seriously hurt themselves or anything like that, then intervention needs to be done before the plan is complete. If it's more verbal and just to irritate that object, frustrate that object, the plan has to kind of play out. You can try to derail it, and sometimes it's successful. But also recognize that it's in place, keep your awareness present, centered, and know that this is part of that punishment plan. It doesn't mean that you have to feel disappointed, hurt, frustrated in order for it to play out, right? We can distance ourselves from the individual who's doing that, and that happens a lot in the therapeutic process, is that you recognize that it's going on, you try to bring as much insight into it. You're not always successful in doing that, so you have to keep that awareness and try to manage it and lessen its severity as best you can and help guide it to play out. It's a very complex process. So I would love to hear your thoughts on punishment plans maybe that you have created for others or that you've created for yourself and how you've gotten through it, or if you've been the recipient of a punishment plan, how have you dealt with it and how have you decreased its severity? So I hope this is helpful for you. Please like, share, and subscribe, and I'll see you next time. Thanks. Bye-bye.